This week is Nurses Week, and while we know the important job that our frontline healthcare workers do all year round during this current COVID-19 pandemic, we know that the job they're doing is even more important. Joining me now to talk a little bit more about Nurses Week is CEO of the Cornwall Community Hospital, Jeanette Despatie. Welcome, Jeanette.
Good morning. Thank you.
All right, so first of all, maybe let's talk a little bit about how Cornwall Community Hospital is recognizing this week.
Okay, number of initiatives to recognize our nurses this week. Of course, everyone likes food, so Dairy Queen partnered with us and brought in some snacks. We're having pizza day. We have several events organized to ensure that our nurses recognize how much we appreciate them.
That's excellent, and as I alluded to, that's so much more important right now. But let's not forget that the job that nurses do, regardless of this pandemic, is very important. Maybe touch on that a little bit about just how important the role of a nurse is.
Sure, it is, and I'm happy to speak to that, and I'd like to highlight that point. Certainly, everyone has stepped up during this pandemic, obviously including our nurses, but I would like to speak to the everyday efforts, the professional and compassionate care that our nurses provide to their patients every day of the year, whether it's in the emergency department or an inpatient bed, palliative care, or the birthing suites. Our nurses do their very best to provide the care that we need.
And when you use words like compassionate and care, obviously those go hand in hand with nursing, but maybe talk about what qualities that are specific to nurses that they have that makes them so excellent.
Well, I think I will speak to actually the core values at Cornwall Community Hospital, and those are our I-CARE values. I-CARE stands for integrity, compassion, accountability, respect, and engagement. And what we ask of our staff when joining the hospital, that they respect those values, that they treat our patients with compassion and respect, and that we demonstrate integrity. I think that these are values that are really core to many of us personally, but as an organization, as a hospital, we think that's important. Our nurses need to live by, to be a good nurse, you really do need to be able to demonstrate those values and really care for the patients that you're trying to help. We know that the patients of our community need good, strong professional care, but on top of that, they need compassionate care.
And it certainly takes a special individual to dedicate their lives to helping others. But let's obviously there's challenges to it as well. So maybe let's talk a little bit about the challenges that our frontline healthcare workers face. And again, not just during the pandemic, but all the time. It's not an easy job.
It is not an easy job. First of all, it's a 24/7 job, right? We need to provide coverage around the clock. Nurses work day and night, literally. And as do many professionals in the hospital, but certainly that's one element. But on the other hand, just the workload today, we know that we would love to have twice as many nurses on staff as we do, so that we had more time with each individual patient. I think their greatest challenge is probably that moral distress they have when they feel they don't have the time they'd like to have with each patient needing their time.
And when we talk about, of course, the current circumstances, they're unprecedented. None of us have ever experienced anything like this. So let's talk about how the nursing staff in the Cornwall Community Hospital have adapted to these times.
Certainly, thank you for that. And I think the key point you make is the adaptability. I will say that folks across the entire hospital, nurses, physicians, environmental service worker, everyone has had to very quickly adapt to this new work, to all of the new processes, the new reality. And I will assure you that with each of these changes came more change. So every day we're trying to keep up. As you said, this is not something any of us have lived through in the past. And quite honestly, I'm very proud of how everyone, including our frontline nurses, have really accepted this challenge and really stepped up in terms of ensuring that they have the proper education, that they have familiarized themselves with the new standard operating procedures, et cetera. So it really, and of course, can't overemphasize the importance of that, both in terms of their own safety and protection, but for our patients that are coming through the doors as well.
Absolutely. And we must say, of course, that the hospital has done an admirable job, as has the community, in terms of flattening the curve. But I want to mention as well, when we see what's happened across the world with COVID-19, what we've seen the impact, we see the images on Facebook of nurses after long shifts in the ICU with all the patients. What does that do for, from the perspective of the hospital and our nursing staff? Our hearts certainly go out to these people. So maybe just talk a little bit about the effect that has.
Absolutely. I can't say enough about the anxiety that that our nurses must feel when they come on shift. I think today it feels better. You spoke to the great efforts of this community to ensure that we did flatten the curve. And to date, that's been so effective. And in fact, it has saved our health resources in this community. I can't imagine dealing with this scenario, and I'll tell you that many of us were so fearful of it, and frontline nurses and doctors, more and as much as anyone, had so many things to worry about, going home, watching those that coverage on news channels, knowing that it was happening in other centers, that the surge was greater than the capacity. Must have been very stressful, not to mention the stress of ensuring one's safety and ensuring the safety of their family when they leave the hospital and go home. So I really can't say enough about how difficult and stressful and anxiety provoking that has to be.
Absolutely. And maybe we could just finish off. Of course, we've seen the other side of the coin, which is the gratitude from communities. We've seen whole cities dedicate time, a certain hour of the day where everybody just cheers for frontline healthcare workers. So maybe we could finish off of why that's important to recognize and how maybe we can just say thank you to our frontline workers right here in Cornwall.
Absolutely, to all the frontline workers. And when I speak to the stress and anxiety that our nurses feel, I'm highlighting them today because it is Nurses Week and so well deserved. But not to mention those same factors come to play for our EMS folks, all frontline providers. And as I said, anyone coming into the hospital today is know that it is a different level of risk. We're not sure what we are dealing with, but taking those universal precautions to ensure everyone's safety. I do want to just speak to the gratitude that we've received from the community and how helpful that is. We do try to highlight for our staff when we receive an expression of gratitude, and it really is helpful and reassuring to them. The community's been wonderful. They've been generous in their donations where they can be, whether it's for PPEs, personal protective equipment, whatever the case may be. When we reached out, there's always a positive response. So we're very fortunate to be in this community.
Well, we certainly know that this community is oh so generous, as you just alluded to, and we all stand behind our healthcare workers. So on that note, we'd like to thank, on behalf of everyone at your TV and the community of Cornwall, a big thank you to all frontline healthcare workers, but this week, especially our nurses, as we do celebrate Nurses Week. And I want to thank you, Jeanette, for joining me for this interview.
Thank you. I've appreciated the opportunity. It's great.